You know, the knee is one of the trickiest areas of the body to diagnose as tension myositis syndrome. Unlike the back or the shoulder or the neck, the knee joint is always in motion and it takes a lot of impact. So it only makes sense that the knee pain could be the result of structural damage. And there's no doubt that many times it is. But not all the time, and maybe not even most of the time. Maybe it's actually rare that knee pain is not TMS. So today I'm going to show you why you can't automatically trust a diagnosis that is based on MRI results. So without further ado, let's talk about knee pain. Hi folks, I'm John Thornton, and today I'm going to review some really good clinical data about knee pain. But before I start, I want to give you a resource. It's our free workshop for curing TMS. Now, Dr. Sarno's books prove why TMS is real, and that's great. But our workshop will actually tell you what to do about it. And if you follow our three-pillar formula, you should see a decrease in symptoms in as little as 30 days. So pick up the video workshop at paincureclinic.us, and there is a link below. Okay, so today I'm going to go over 3 clinical studies related to knee pain, and they will at a minimum make you question why there is so much knee surgery going on in the United States. Well, actually at $35,000 a pop, maybe it's not such a mystery. The first study that I want to go over comes from the prestigious New England Journal of Medicine, and it was done in 2008. The title of the study is Incidental Meniscal Findings in Knee MRIs. There were 991 test subjects aged 50 to 90. The study found that the prevalence of meniscal tear was 63% among those with knee pain, aching, and stiffness. However, meniscal tears were also present in 61% of those without symptoms. The study also found and concluded that the majority of meniscal tears were actually found in people who did not have knee pain, aching, or stiffness. Now, logic might lead one to conclude that there is no correlation between meniscal tears and knee pain. However, as we know, logic may not be the most important factor when determining whether surgery is necessary. The next study is entitled Knee MRIs in Asymptomatic NBA Players, and this was from 2014. Asymptomatic just means they had no pain. So they did MRIs on both knees of 20 professional basketball players. The MRI study showed cartilage damage was found in almost 50% of the players. The study commented that this was a high level of damage relative to the general population. The study also came to the conclusion that these athletes perform at the highest demand level, which indicates that the presence of cartilage damage does not cause pain symptoms. Okay, let's move on to the last study, which is the best one because it's a systematic review that pulls data from 63 previous studies. It's from 2018. This study was looking at the relationship between osteoarthritis and knee pain. The study looked at MRIs of almost 5,400 knees, and every knee in the study was asymptomatic, meaning pain-free. Here are the results of that study. They found that 43% of the people over the age of 40 had torn cartilage. They also found meniscal tears in 23% of all people over the age of 40. And they found that osteoarthritis was present in 25% of the knees in all people over the age of 40. And remember, these were all 5,400 knees without pain. So the study came to 2 conclusions. First, osteoarthritis, meniscal tears, and torn cartilage are common among asymptomatic, uninjured knees and are generally associated with age. They also concluded that since more than 1/3 of the older population will exhibit these knee characteristics, medical or surgical interventions targeting these imaging findings may not alleviate pain in patients with knee symptoms. Now, I'm not a doctor, but I think that most knee pain is probably just tight and inflamed muscle tissue. I think our bodies are much more durable than we give them credit for. You know, I'm a long-time runner, and I recently figured out that I've run approximately 26,000 miles in my lifetime, which is greater than the circumference of the Earth. And I have absolutely no knee pain. My guess is that most knee pain is just TMS. Okay, folks, that's it for this video. I hope it was helpful. Don't forget to pick up that free workshop before you go and hit that subscribe button. And thanks for watching.